So one of the things I realized is, as I told you, one is of course similarity because it produces so much systemic and organ damage. The second thing is that people, if they recover, they prevent so much disease from occurring later in life. There's research to suggest that, for example, people who smoke and have severe mental illness, they tend to die about 10 to 15 years earlier. Their life expectancy reduces. So even with people who have addictions, the increased premature mortality is very high. Their chance of dying from accidents is very high. Their chance of dying from suicides and overdoses is very high. And unfortunately, while the prevalence of it has been increasing all around the country, this understanding of how do you protect yourself, how do you kind of overcome it, I think is still very, very low. People believe that people with addiction have to help themselves. But then you don't say that to people with diabetes. You don't say that to people with, let's say, with a tendency to have a stroke. You don't. So the same way, I think people need to understand why certain people are addiction prone. How do you help them? Because you can. And of course, if they do develop an addiction, without judging them, without stigmatizing them, with engaging the family members. Because, there's a saying that alcohol destroys the family long before it destroys the liver.
Absolutely.
So I think really getting them to families to understand that. Families to be supportive. Families need support to be supportive. It's very easy to ask families to be supportive, but they've gone through so much distress that, that sometimes there are certain behaviors in the family which actually maintain the habit. So how do you support families and make sure that they do? So it's not just the individual, it's the entire family. And somewhere it's also the entire community that you have to engage. Because, if you look at the tobacco policy, for example, decades and decades of research to say that tobacco is harmful to health, and really looking at advertising, looking at public smoking, having deterrents in place, we've actually reduced the quantity of tobacco use, particularly smoking in public places has come down, and I think it's a reduction of almost 7%. As compared to some survey called the Global Adult Tobacco Survey. And of course, there are other surveys in the country. And between one GATS and the other, India has actually shown a reduction. It's still not enough, but it's in the right direction. But I think we need to do a lot more of that public engagement.